Acupuncture, you stick needles on a person. Well, you stick a needle just like throwing darts, you know. You have to aim at the right spot. Those are called acupuncture. Some people are scared of needles. So the Chinese come out with a lot of gadgets. They have acupuncture by just touching an electrical pulse on a certain point. Like this spot here is called Herbal. See the meeting valley of energy for the lungs. So if you have a toothache, you put a needle here, in 5 minutes, your toothache will be gone. So that is acupuncture. Acupressure is to apply the same spot with the pressure of your fingers or thumb. Let's say if you have toothache, you can press this point with your own finger, and that can stop the toothache. On both sides, not just one side. So if your toothache is on the upper teeth, the points are on the web of the foot. That is stomach 42, nating. Nating can stop the toothache on the upper jaw, and it only takes about 5 minutes to stop it. On the lower jaw, of course, is on this point. So if an acupuncturist is a good acupuncturist, he can instantly fix you. And of course, we have fixed people with acupressure or acupuncture so fast, they think that we are doing something that is incredible. I have a young girl came in one day, she has binding to the teeth. And because the doctor was fixing the teeth, you know, trying to pull them straight or pull the teeth that is growing sideways, yeah, they brace that thing so bad that she can eat. She has so much pain and she didn't eat for 2 days. And when she came over, I pressed on these 2 points. I told her after about 3 minutes, I said, knock your teeth together. Like that. Knocking. And she said, I can't do it. But in 2 or 3 minutes, I asked her, I said, try it. And she did it. And the pain was gone. And in about 10 minutes, she went over to the noodle house and have a bowl of noodles. After she can eat for 2 days. So that is fast fixing. So we know that the body has a lot of potential points that can stop headaches, that can stop pain, that even relieve a heart attack. Now, to relieve a heart attack with acupuncture or acupressure, from your elbow to the wrist, you just put the finger to the middle, that is in between the elbow and the wrist, and you put one more finger. And that point can instantly relieve a heart attack if a person is having that. So acupressure is a different thing. Acupressure, when we are doing acupressure, we either use the thumb or fingers or 2 fingers. For instance, if you want to put acupressure for the eyesight, it is right in the center of the eyebrow. You can put 2 fingers like that to strengthen 1 finger, you double the fingers, and that actually activates the energy flow to the eyes. And that helps the eyesight. If your eyes goes blurry, or sometimes you know your eyes are tired, that is a very good point to press on. Now, of course, if you press on this point and rub on the side of the temple, your eyesight will be instantly brightened, almost instant, because the energy flow is there. So that is called acupressure. Now, acupressure and massages, they're slightly different. Now, deep massages is also like acupressure, but when they massage deep, they have to use a lot of strength, especially to press it downward, so that they can feel something that is very deep in the blood vessels that are blocked. Sometimes the blockages are very tiny. You cannot feel it just by touching over or rubbing on the top of it. You really have to press it deep and find the spot that is either there's a lump or a hardness, or there is a cyst, some sort of a cyst-like thing underneath the flesh. If you are doing that, that we call acupressure. That acupressure actually works on all kinds of aches and pain, and that's the fastest way to relieve it. But of course, if a person has nerves injuries, we use acupuncture. And if the problem is only a small problem, we use acupressure. So sometimes all depends on what they like. Some people are scared of needles, they have phobias. You know, they see a needle, they start shaking. I have clients coming in like that, you know, you show them a needle, they already start shaking or trembling, you know. But if I stick a needle on myself and they look at it and say, wow, there's nothing to it. So that takes away the phobia sometimes. So when we talk about the acupuncture, acupressure, deep massages, those are all the assets that will fix the body in just a different way. There are of course more ways to do it. Like if the pain is migrating, you know, if your pain is one day on the arm, one day in the leg, we call migrating pain. Those kind of arthritis, the doctor said is only in your head, because they cannot understand that the pain can migrate. Doctors believe pain cannot migrate, they stick in one place. But actually they do migrate. Now if the pain migrates from one part of the body to another part, you have to use suction cups. That's why the Chinese use suction cups. Suction cup is to create a suction in a cup on a certain acupuncture spot, and you pull the wind out of the body. We call it wind factor that affects the pain. Now wind factor, how do we get that wind factor that can go around the body, you know, migrating pain? Is due to the cold air that we expose to ourselves in the winter. Let's say you go out and it is very cold outside, minus 30 or 40 below, and there is strong wind blowing. Of course, the body can take that thing in because of the pores. The pores on the skin, if they are very hot and open, it will actually suck in the cold air, just like a vacuum. And when the cold air is sucked in, it will run together with the blood and the qi. And of course, the cold air is not good for the body. And they give arthritis or rheumatism. So in order to take it out, we use a suction cup. Oh, suction cup is the only solution that pulls the air out. So there's the best fix. Of course, you can use a moxa bastion. Moxa is a long stick of herbal cigar. It's just like a big cigar, but you burn it on one end, and then you go to a certain acupuncture point. You start turning that stick around. Of course, you don't put it too near, then you get a blister on the skin. So if you do that, you know, by turning anti-clockwise, you will take the wind out of the body. You have to do it anti-clockwise. If you do it clockwise, that means it is feeding more into it. So you have to know what you are doing. So that is called moxa bastion.